Question number 1. Which of the following is the genetic cause of male infertility? The right answer is option B, Klinefelter syndrome. Question number 2. The condition in which sperm are present but cannot move effectively is called. The right answer is option C, asthenospermia. Question number 3. Which autoimmune disorder is known to affect female fertility? The right answer is option B, systemic lupus erythematosus. Question number 4. Recurrent pregnancy loss is most commonly associated with. The right answer is option D, advanced maternal age. Question number 5. The luteal phase of the menstrual cycle is typically half long. The right answer is option B, 10 up to 14 days. Question number 6. Which of the following can cause infertility due to sperm DNA fragmentation? The right answer is option A, smoking. Question number 7. Ovarian reserve is best assessed using which hormone level? The right answer is option C, AMH. Question number 8. Immunological infertility in males is typically due to. The right answer is option A, anti-sperm antibodies. Question number 9. Hyperprolactinemia can cause infertility by. The right answer is option B, inhibiting ovulation. Question number 10. Which imaging technique is commonly used to assess uterine abnormalities? The right answer is option C, hysterosonography. Question number 11. The term cryptorchidism refers to. The right answer is option C, undescended testicles. Question number 12. Which of the following is a potential side effect of ovulation induction therapy? The right answer is option A, ovarian hyperstimulation syndrome. Question number 13. A bicornuate uterus may cause infertility due to. The right answer is option B, abnormal uterine shape. Question number 14. Testicular biopsy is mainly performed in cases of. The right answer is option C, azoospermia. Question number 15. Which environmental toxin is known to affect fertility in both men and women? The right answer is option A, lead.